having the multiple surgeries that I've had, having surgeries with and without the ambIT, I would highly suggest having the ambIT. It certainly worked for me. I can only imagine it would work wonders for another person.
Zach had had an unfortunate fall from a roof and had what was known as a terrible triad fracture of his elbow, which required extensive surgery.
I broke my elbow. Really messed it up, so to speak. Ripped up the tendons, ligaments, pulverized the muscle, not to mention breaking the bones.
Zach also had an underlying neurologic condition which made regional anesthesia a prohibitive risk. It was very, very important that he aggressively undergo physical therapy to try and achieve the best chances of success. And in the 2 surgeries he'd found that he was unable to fully participate in that therapy because of pain.
For the first couple surgeries, I didn't get to use the ambIT because there's a risk of the numbness that it could cause in my arm because of my condition. So they didn't risk it, but actually made it very difficult to go through the therapy after the surgery because the pain was quite exceptional. Could barely move, was barely tolerable. Sleeping was definitely a challenge.
So before the last surgery, we had extensive discussions with Zach, his parents, the surgeon, discussing the risks and benefits of regional anesthesia with an ambIT pump for post-op pain management. Everyone agreed that pain control was going to be of the utmost importance to his ultimate successful outcome. Therefore, despite his having a pre-existing neurologic condition, the decision was made to give him the best chance for success and to do a regional technique using a ambIT pump and perineural catheter for post-op pain relief.
It was wonderful. It worked. Sleeping, I was able to sleep. Therapy, definitely tolerable. I was able to hit the button, get a small dose extra, and just go right into therapy. I was able to move, which was just astounding for me. From going from doing this to actually being able to rotate my wrist for just one of my surgeries, having the ambIT help out with that, it was just lovely.
Zach was discharged home with his ambIT pump and a 3-day supply of medication. He underwent continued physical therapy at home and ultimately ended up with an excellent surgical result for which both he, his family, and his surgeon were very pleased.
Going through it, having surgeries with and without, I would definitely go with. I would recommend it because it works and it was a boon. It was just wonderful, completely painless, all of it, and it was just wonderful. I liked it a lot.